Tuesday, December 8, 2020. Welcome to the online ART training in Module 1B on Sperm Morphology. It is 9 a.m. Eastern Standard Time. My name is Ashok Agarwal, and I'm going to be your host for the next 2 hours. We are here in Cleveland Clinic in Cleveland, Ohio, United States. Just a very short introduction to myself. I am the head of Andrology Laboratory at the Cleveland Clinic Foundation in Cleveland, Ohio for past 28 years. I'm also the director of the American Center for Reproductive Medicine. I'm a staff in urology at Cleveland Clinic. And I'm very proud that our team is rated as #1 in the world in the fields of male infertility, andrology, and human-assisted reproduction. This is based on the number of peer-reviewed publications, citation scores of people who are using our articles into their own publications, and an H-index. These together can be searched by anybody in any part of the world using Scopus. We have a large number of books in the area of human reproduction, and many more books are going to be coming in. And our laboratory has trained a very large number of scientists, clinicians, and graduates and undergraduates from the United States and more than 85 countries. So with these words, I want to welcome all of you who are attending the program. We are expecting a number of about 1,400, some numbers, and I think you will see in the slide who have registered. The capacity of WebEx platform, which is being used to air this program and reach out to all of you, is 1,000. Those who are not able to get in and who join a little bit late will be able to see this program live via the streaming link which has been provided on the WhatsApp. For declaration, the organizers and the speakers have no conflict of interest. No companies or outside entities were contacted for sponsorship. The program was made entirely possible by support from the Cleveland Clinic. Webcasting was supported by our colleagues David Reichling and David Wolfley from IT, who have generously supported our program last month as well. The course faculty have generously donated their time for this online training and have spent pretty much the entire 1 month preparing for this course, as you will hear. Program coordinators, we have a fantastic team of 9 coordinators from all different parts of the world who have generously donated a large amount of their time on a day-to-day basis for this training. The names, images, and description of certain products or instruments shown or discussed during the lectures in today's presentation are being used routinely by us in the Andrology lab. These items are not endorsed by any of us as speakers. So let's talk very briefly. The learning objectives of today's module is to develop an understanding of sperm morphology by WHO 5th edition, understand the staining protocol used in the laboratory, learn the use of strict criteria classification, understand the external quality control in sperm morphology, learn about and there are many troubleshooting tips that we are going to present. So the next presentation is again by Dr. Sharma, and it will be followed by Dr. Gupta. And the speaker are going to start with a sperm quality evaluation by strict criteria. So here, the emphasis of the talks are going to be actual process of scoring the slides using the 5th edition criteria. So they are going to walk you through each and every step as it was in the previous presentation, where they told you about how to prepare the smear, how to do the staining, and then how to actually do the quality control. So the focus here is, by virtue of examples, is to show how the actual evaluation is done. So Rakesh, you can begin. We are running a little bit late, so let us continue.
Thank you, Dr. Agarwal. So the talk will be sperm quality evaluation by the strict criteria. Next slide, please. The learning objectives are to understand the normal sperm morphology using the WHO 4th edition, as well as giving example using the 5th edition. We will also learn examples of morphological abnormalities, learn the correct use of a micrometer for measuring sperm dimensions, and recognize examples of normal sperm measurement. Next slide, please. This slide shows the sperm dimensions utilizing the WHO 4th edition or the 99 edition, and also comparing it with the WHO 5th or the 2010 edition. If you look out to the left, the WHO 4th edition, the normal sperm cutoff was 14% or more than 14% normal forms, and all borderline forms were considered abnormal. If you look into the WHO 5th edition or the 2010 edition, the normal sperm cutoff is now 4% or more than 4%. These results are reported as the 5th centile reference ranges, and all borderline forms are considered abnormal. Next slide, please. These two smears show examples of normal and abnormal sperm which we encounter when we look into the morphology slides. So the same smear can have different forms, and this is represented in these two images. Next slide, please. In the next few slides, I want to illustrate the examples of abnormal sperm heads, and also on to the left, you have the example in the insert of how a normal sperm looks like. So it is easy comparison to see the difference between a normal sperm form as well as abnormal sperm. And this is an example of amorphous heads. So these are three images which are distinctly different, and they look totally different than what a normal sperm should look, as you see in the insert. Next slide, please. This is again another morphological defect, and in this case, this is called the tapered heads. And these are the sperm heads which are long, slender, and they are cigar shaped, and they are significantly different than what a normal sperm looks as seen in the insert. Next slide, please. This is an example of small heads, and in the three images, you can see the sperm head is significantly smaller than the normal looking sperm, which is seen in the first image. Next slide, please. This is an example of sperm with small acrosomes, and as Dr. Gupta mentioned, that the sperm head should have 40 to 70% of the acrosome. These are examples which absolutely show no sperm, or they have very poor sperm showing the acrosome area. And this is a common feature which we find in patients who are having varicocele. Next example. This is an example of Globozoospermia, where there is a preponderance of sperm which look round, and there's a complete absence of the acrosome. So these are examples as shown by the arrows of the sperm which look round, and they have complete absence of the acrosome. Next slide, please. This is an example of mid-piece defects, and the mid-piece Defect is because of the presence of an excessive residual cytoplasm that is present in the midpiece. And these are the three examples of the type of midpiece defects that we see in samples from the patients. And this midpiece defect is the cause for the abnormal cytoplasm seen right after the sperm head. Next slide. And lastly, this is an example of abnormal tails. And in the first image, we can see the tail is bent as well as coiled tail. The second image shows the presence of a double tail. And the last image on the right shows a coiled tail. Next slide, please. So again, I would like to highlight the dimensions so that we know what a normal sperm should look like. Next slide, please. If we have to measure the sperm dimension, we use the micrometer and we place the sperm on the y-axis and we can measure the sperm width, which in this case is 3 micrometer. And next we can place the sperm and look for the sperm length on the x-axis. And in this case, the measurement shows 5 micrometer. So as per the 5th edition, this sperm will have a normal sperm dimension. Next slide, please. In the next few slides, I would like to show you examples how we measure accurately the sperm head and the sperm width. So the first image shows the sperm, which we presume looks normal, but we want to confirm that this indeed is normal. So we place the reticle on the sperm length. And in this case, the length of the sperm is 5.1 micrometer. And then we place the reticle on the sperm width. And we measure the width, and in this case, on the image to the right, the width of the sperm is 3.1 micrometer. So this sperm shape would be categorized as a normal sperm. And now we can appreciate how accurately the measurement is important in categorizing the sperm as normal and abnormal. Next slide, please. This is another example where we are measuring the length as well as the width of the sperm. And in this case, the length is 5.1 micrometer and the width is 3.5 micrometer. So again, this is a sperm with normal dimensions. Next slide, please. Now that you have seen the different types of abnormalities as well as the normal sperm, I would like to give you a short quiz. And here are 4 images. The 4 images are classified based on the head shape, the head defects or other defects, the midpiece defects, and the tail defects. And I would like you to take a short quiz in the next 20 seconds and see, based on these criteria, how would you classify these 4 images either as normal or abnormal. So take a few seconds and categorize these into normal and abnormal sperm. Next slide, please. So let's review how you classified these 4 images. Looking at image number 1, if you look at the head shape, it is abnormal and it is flat and the midpiece is thick. So overall sperm classification for image number 1 would be a category of abnormal sperm. Looking at image number 2, the head shape is normal. There are no other head defects. The midpiece is normal. So this sperm will be categorized as normal. If you look at image number 3, the head shape is normal, but the midpiece is thick and very long, and this sperm would be categorized as abnormal. Finally, if you look at the image number 4, the sperm shape looks normal, but the acrosome is small, it is less than 40%, and therefore we will categorize this sperm as abnormal. Next slide, please. So in my presentation, I have walked you through the correct measurement of sperm dimension, and these allow the correct classification of the sperm as either as normal or abnormal. So it is very important to differentiate the classification of the sperm into normal or abnormal category. The use of a micrometer is extremely important for the correct measurement of the head dimension, and ongoing training is recommended to correctly assess the sperm morphology. Following these steps will help in the accurate identification of the normal sperm forms. Next slide, please. This is our group, and these are the summer interns. Next slide, please. This is a beautiful image of the Cleveland Clinic, and thank you very much for your attention.
Thank you very much, Rakesh, for a beautiful presentation. Now we move very quickly to the next speaker, which is going to be Dr. Gupta. So let me begin her, and she will continue and she will discuss the quality assurance aspect, and she will define what is the quality assurance with respect to sperm morphology. So Sajal, you can jump in and try to keep it very concise. We are running late.
Yeah. So thank you, Dr. Sharma and Dr. Agarwal. And my topic was introduced. So the careful analysis of sperm morphology needs a great deal of expertise and implementation of quality assurance in a meticulous manner. The learning objectives for my presentation are training in sperm morphology and competency assessment, quality assurance for sperm morphology evaluation, proficiency testing and external quality control, and then tips for optimizing sperm morphology and understanding the sources of error. Next slide, please. So, as alluded to earlier speakers by Professor Henkel, lack of standardization in sperm morphology is a major issue, and this results from different techniques of smear preparation, differences in staining procedures, and also lack of training. So how do we do the training in sperm morphology? And in our laboratory, we have strict guidelines. We have a SOP for training the technologists using a teaching microscope and then using documents, having them assess at least 20 sperm morphology samples and then making sure that the trainer and the trainee are doing the scoring together. I provided examples on the right side of the average sperm normal forms for the trainee, which was 11%, and the trainer 12%. And so no corrective action was required because the acceptability criteria were met for both assessments. If you look at the second, there is the trainee who has assessed 21 and 23 with an average of 22% normal forms, whereas the trainer has an average of 7%. So definitely the difference is very wide and corrective action was required. And then we have to go back and train again the trainee in correct use of optical micrometer and correct identification of normal sperm forms. Next slide. So competency assessment is done because what has been observed, why there is lack of standardization, is because there is high inter-technician variability. And for any high complexity testing, we do competency assessment. This is done by the technical supervisor as per the Central Federation guidelines. It's done by direct observation, which is side-by-side scoring, monitoring and recording the results, review of intermediate test results, and evaluation of previously tested or internal quality control samples and assessment of problem-solving skills. So on the right, I've provided the competency assessment form where it is broken down into steps. We quiz the technologist. We look at each step, including staining, quality control, staining steps, scoring the diff quick smears. Next, please. And so on, and then the reporting of the results. And we also see that the intra-technician variability in terms of the replicate measurements is not very high. And then once they meet all the criteria, we say that they are competent in performing sperm morphology. But if they fail, then I will have to go back and reassess the competency. Next. So to quiz you all, there are two smears on the left and the right. So have a look and see which smear is a good quality smear. So if you have thought it through, I will come up with the answer. On the right side, as you can see, this is a smear which is performed in our lab, and there is no background contamination. The spermatozoa are showing clear demarcation for the pre-acrosomal and the post-acrosomal region, being the acrosome being light lavender, the post-acrosome being dark lavender, clear demarcation of the midpiece, and then the tail. Whereas on the left, it's a poor quality smear. The demarcation is not seen. Next. So quality assurance is an ongoing process, both quality control, quality assurance, and quality improvement. And one has to have certain quality indicators. So here I'm providing an example of a quality indicator. How do we assess intertechnician variability? So there are different plots, and these are given in the WHO 5th edition manual. But what I have provided an example is a Bland-Altman plot, where we have the same morphology smears scored by two technologists. And on the x-axis, you have the average person normal forms. On the y-axis, we have the difference in the person normal forms between the two technologists. And the line in the middle is the mean, and then we have plus minus 2 standard deviations. So this is very good correlation between the two technologists. All the values except one are within plus minus 2 standard deviations. That means there is no intertechnician variability in terms of multiple samples for sperm morphology that have been assessed. Next slide. So it is also important when we are tracking the quality indicators, we have to see and go back and assess where the error is arising. So the different steps have to be, evaluated and checked and see where the error is arising, and then accordingly propose or mitigate the problem. So some of the examples are the microscope is not being used correctly. It's incorrect magnification. Maybe the technologist is not using the optical micrometer correctly, as was highlighted by Dr. Sharma, or there are subjective techniques being used. They are not strictly following the 5th edition guidelines, and so on, poor smear preparation. So basically, it's a quality improvement process as well as a quality assurance process that you look at all the steps, identify the error, and then the resolution is in terms of providing training or having them read the standard operating procedure, or having them, assess some internal quality controls or external quality control. There's also an X bar chart where they could assess the same sample multiple times and see what is the agreement each time they have scored the sample. Next slide. So there are colleges which send smears for proficiency testing. And in the United States, the agency is called College of American Pathologists. So this is deemed by the Health Administration in the United States, and they provide quality control analytes or external quality control analytes twice a year. And every 6 months, we get 2 analytes. We have to test these analytes as patient samples, and then we report them as per the WHO 5th edition criteria. We have to meet the acceptability criteria, which are provided by the College of American Pathologists. And if not, then we have to take corrective action. Next slide. So these are the actual results. This is from a previous evaluation. And our results are for both the analytes, 4%, so that is normal, 2%, which is abnormal. And then on the right, they have provided the mean of all the labs that had done the testing for these analytes. And the STIs are minus 0.4 and minus 0.5. So these are very tight, and our results were acceptable. And this is what I've highlighted, the acceptability criteria within the box, mean plus 2 minus standard deviation. And sometimes if there is lack of consensus, then they might grade the results as 26. And this grade is that you do your own internal quality control, have all your technologists, after the last date of submission of the results, do the assessment, and then you come up with the own, within the lab, mean plus minus standard deviation, and then the director, which is Dr. Agarwal, will review them and see if they are acceptable. Next slide. So overall take-home message is that quality control and quality assurance are an ongoing process. So they never stop, and each step of the procedure needs to be monitored, and meticulous quality control implementation at each step is necessary. And this is a requirement for lab accreditation, as well as making sure that your morphology results are precise, they are accurate. The second is proficiency testing. It again, if the lab is meeting the CAP guideline, then you are reporting accurate results. It's a validation of your laboratory results. And wherever the quality assurance process shows that there is errors or there are problems, then you go back and look at the root cause analysis. And depending on what is the root cause or where the step which is not being performed correctly, corrective action with appropriate training and quality control intervention is essential. And this is an important component of overall quality assurance for sperm morphology, as well as quality management. Next slide. And I appreciate your attention for this important aspect of sperm morphology, quality assurance, and thank you very much.
Thank you very much, Sajal, for your excellent presentation. We are going to move to the next presentation. This is our group at Cleveland Clinic in Andrology Center, and this is one of the images of the Cleveland Clinic. And you can connect with our program. We are posting daily our research activities, large number of research articles. You have free access to all these publications that we are offering. We are also sharing our latest research presented at ACRM, which is American Society for Reproductive Medicine, European Society for Human Reproduction, American Urological Association. Also, you can learn about our research opportunities and ART training, which are online ART training and opportunities to collaborate. You just have to find me on LinkedIn, Ashok Agarwal Cleveland Clinic, and you can send a request to join.